I'm an orthopedic surgeon that has spent the last 18 years researching value-based care, and that includes over 100 publications on the topic, 2 textbooks, and research that was featured in the New England Journal of Medicine. So here's 18 years of experience on how to help you and your health plan lower costs of care for musculoskeletal conditions. My first piece of advice, find a clinical solution and not a tech solution. The costs of musculoskeletal care are leading drivers for most health plans, and they keep getting higher and higher. Why? Because we do a lot of unnecessary treatment. Surgeries, injections, MRIs, procedures, all kinds of imaging tests, medications, everything, you name it. In fact, 30% of the surgeries that we do are totally unnecessary. So what happens is we keep doing this unnecessary treatment. We live in a fee-for-service world where doctors and hospitals get paid to do surgeries. And so, no surprise, more surgeries happen. Now, how do we fix this problem? Well, there's 2 ways. One, you could use traditional downstream utilization management and just deny care. Now, you can do that, but you're going to anger your members on the health plan as well as your participating providers. So just something to consider. Now, if you don't want to go down that route, what you've got to do is 2 things. Number one, you've got to make your health plan members healthier before they get recommended all these unnecessary treatments. And 2, you need to educate them on how to manage their condition and cope with their pain so that they're not running to the ER or to the specialist every time the pain flares up and using all these unnecessary treatments and surgeries. If you look at some of the really big digital MSK companies in the market, you're going to find that they're actually built and composed like technology startups, because that is what they are. They are tech-forward solutions that use a lot of things like AI navigation, motion sensor technology, automated, coaching programs that really are not rooted in clinical evidence. And so what happens, these programs are really good at treating the 80% of people that drive 20% of costs. Think about your employed desk workers that are having some low back pain or neck tightness because they've been staring at their computer screen all day. These are not the folks that are going to go to the emergency room and get an unnecessary hospitalization or an unnecessary surgery. The problem is for these health plans is the 20% that are driving 80% of the costs. Think of your Medicare members with chronic back pain that are about to get a totally unindicated spinal fusion surgery, or a Medicaid member who keeps going to the emergency room every time the pain flares up. Those are the people that are driving the costs. And the problem is that the technology-facing solutions are not able to engage these folks and actually make them better. The reason is because these folks need real clinical care. They need to get diagnosed with a condition. They need to get formal treatment. Now, that treatment may be rooted in exercise therapy, but it's going to also include pain coping, diet and nutrition counseling, and lifestyle and behavior changes. And so you need a team approach of human beings to help these folks out, to get treated and to get educated on their condition. And that is why you need a clinical solution delivering synchronous live care. It can be digital, and that's really a great way to scale, actually, to get digital care that can be accessible to all. But you need a human on that line running the show, not a bot or an AI care companion. If you want to use AI for these things, that's great, but use it on the back end for the patient management, the billing, the enrollment, the coding, all those things, not for the delivery of the care. And so if you are a health plan that wants to really lower costs of care, you have got to find solutions that are clinical in nature that can make people healthier, that can educate people much better. Short of that, you will not move the needle. And it can be a really good employee benefit. And that matters, right? You want something engaging for your employee health benefits, something that increases your retention and your productivity, but it will not be designed to lower costs of care. And that is a problem for health plans that are taking risks, especially for their government health plan members. If you're enjoying this content and want to keep getting more education and information about exclusive events that we're putting on at Protera Health, please subscribe to our newsletter, and the link is in the comments below. My second piece of advice, measure and report real outcomes. If you're going to use a digital health solution for your health plan members, you need to be able to make sure that the members are getting healthier and more educated. That means these outcomes have to be collected and reporting. A lot of the big companies right now are getting paid based on the fact that the member or the employee logs in at certain times. There's no way that is enough time to meaningfully change behavior and treat a condition that is likely to go on to get an unnecessary surgery or intervention. So, how do you, as a health plan, rest assured that the digital solution is moving the needle on outcomes and education? Now, when we look at outcomes, we're not talking about pain scores or intent to undergo surgery. Those things do not have any clinical validity whatsoever, and that's been proven time and time again. What the digital solution has to measure are patient-reported outcome measures. These are the best tools that we have available that can measure somebody's health state from a physical function, pain interference, which is the impact of pain on quality of life, or mental health perspective. So if you're not measuring these domains, then really you're not measuring anything meaningful with that member. Now, the second thing, which we've been talking about, how do you know if that member is getting educated? Do you know that they're not going to keep going back to the emergency room or back to the surgeon every time the pain gets worse? You may be saying, well, there's no way to measure that in a quantified way, but there is. It's called patient activation. It's the measurement of the understanding, skills, and confidence somebody has in making better health and wellness and lifestyle decisions. And guess what? You can measure it. Now, there's some very robust tools that are 11 questions, 22 questions long. We use our own tool that's 5 questions long. Either way, we're measuring it and we're reporting it. And that is the best way for you to understand that the digital health solution is doing its job. Now, there's one more piece to all this. The digital solution should not get paid until it moves that needle on health outcomes and on activation. Fees should be at risk pending successful achievement of real improvements in these domains. If they're not at risk for those metrics, then what are you actually paying the solution for? So my advice is to use a digital solution that reports their outcomes being proms and ideally some measure of activation, and puts their own fees at risk if they don't hit meaningful improvements across the board. My third piece of advice is to maximize access. The best way to lower costs of care in your population is to make sure that everybody has access to the best treatments you can provide. And when we're talking about digital health solutions, you need to make sure that everybody, as many as possible, can access that solution and benefit from it. If you look at a lot of the big companies right now in the digital MSK space, as we discussed before, they use a lot of things like motion sensors and tablets and all kinds of these AI tools. A lot of times you need a reliable broadband internet connection. You need a tablet. You need a lot of space to work so that the sensors can be picked up. Well, guess what? Not everybody has access to those things. Oftentimes, our underserved members are at high risk for getting unnecessary treatments and do not have access to reliable broadband or all the other things I just mentioned. So the problem is that if you have a digital health solution that requires extensive hardware, software, and broadband internet, you won't get your entire member population, especially the ones that might be driving up your costs unnecessarily. So you're going to say, well, digital health means high tech, so there's no way around it. Well, that's not the case. The key is to find a digital health solution that can be accessible by everybody. Now, I know what you're going to say. This is digital health. That comes with the territory. But ever since COVID, we all know that everybody is using their phones, webcams, whatever, for face-to-face web meetings, right? So we can take advantage of that and design a digital solution that requires nothing more than a smartphone and any sort of connection, cellular or wireless broadband. And if you can make a digital solution that requires only those minimal inputs, then you have maximized the accessibility of the program to your entire member population. This makes it much easier to use, much easier to adopt, and much easier to implement on a population scale, which makes it much more likely for you to lower cost while improving member health outcomes. My fourth piece of advice is to get longitudinal follow-up. As we discussed earlier, if your digital health solution is only engaging members or employees for a week or two, it's just simply not enough time. For non-operative conditions, you need at least 6 to 12 weeks of treatment to really improve that condition and then get improved education so that you know how to manage that condition going forwards. That means you've got to not only keep that member or employee engaged for 6 to 12 weeks, but you've got to measure outcomes along the way to make sure that they are getting better health and getting better activation. So you need a digital health solution that will at the least measure outcomes at 6 weeks, if not 12 weeks. Now, it does not end there. Once that 6 or 12 week period is done, the formal engagement may be over, but the digital solution needs to keep that member engaged going forward so that if there is a pain flare up or recurrence or a new condition, that the member can then go back to the program and continue to receive treatment or benefit from the service, whether that's continued membership on the portal for education or exercises, or the ability to re-engage the care team. Ideally, the digital health solution is not only making these services still accessible or their portal for exercise and education still accessible to the members, but also providing continued benefit, such as electronic correspondence or education that the member can benefit from long after the program has been completed. That is how you get the most impact from a digital health solution from a longitudinal perspective. My fifth piece of advice: find the 20% that are driving 80% of the costs and not the 80% that are driving 20% of the costs. Now, if you've gotten to this point in the video, you know I'm a big fan of the Pareto Principle with the 80-20 rule. And it's no different when we're trying to lower costs of care for our health plan population. We need to find the 20% of health plan members that are responsible for 80% of the costs. Now, to do that, you need to do three things. First, you need to actually identify who those members are. And the best way to do that is through the use of procedure codes or diagnosis codes that can help identify members as they're getting their first set of claims, whether it's their first doctor's office visit where they're diagnosed with low back pain, or their first hip x-ray or knee x-ray for their arthritis. Secondly, you need to engage them early. As soon as that claim comes in, or as soon as the report comes out from their health system, if you have that partnership, you need to outreach these members right away. The further they get down their treatment plan in today's fee-for-service infrastructure, the further they are and the closer they are to getting recommended a totally unnecessary surgery. So you've got to engage them early. And if you have a clinical solution that takes great care of your members, well, then you're giving them a good treatment anyway. And then third, you need to do multi-channel outreach, whether that's phone, email, postcard, letter, newsletter, whatever. You need to get those members from different angles to maximize the chance of getting that early engagement. And so, in closing, if you've gotten this far in the video, then clearly you care about lowering costs of care while improving health outcomes, and also understand that digital health may be a really great tool to do so. And so, as you look at digital health solutions, whether ones you've already implemented or ones that you're looking to implement, take a close look at the robustness of the clinical delivery of that solution. At the end of the day, we're trying to make people healthier and more educated and more activated. And so use that as your criteria to understand if that digital solution is going to take care of business or not. If you enjoyed the content in this video and would like to discuss more or explore how we might be able to help you implement a digital health solution to lower your MSK cost of care, please feel free to check out our website or send me a direct message and we can continue the conversation further. Now, I'm going to leave you with a story of one of the first health plan members that we ever engaged at Protera Health. This is a 75-year-old woman, African-American in New York State, Medicare Advantage member. When she signed up for the program and I heard about her, I was pretty convinced that there was no way we could help. She had crippling back pain, used a walker, if not wheelchair, had every medical problem under the sun, diabetes, heart disease, all kinds of stuff. She could barely get on the phone and use her smartphone to log into the website to start her intake survey. So I said, let's see how it goes. Let's give it a try. Not only did she get through the full 3 months of the program and absolutely crush it with her proms for physical health, pain interference, mental health, she stayed engaged, logging in well after the 3-month program was over. We kept seeing her name, doing her exercises day in, day out. We checked on her 6 months later to see how she's doing. She said she's been doing home exercises almost every day of the week. She has not needed to go back to the emergency room for pain flare ups like she used to do. And she even sent us a poem. So that case taught me that we can really take care of anybody if we set up our program the right way. For those of you who don't know, we started Protera Health with the mission to help health plans lower costs of care while improving member health and satisfaction. Our founding team has over 30 years experience in value-based healthcare, managed care, orthopedics, and clinical informatics, and we came together to deliver this mission for health plans. If you enjoyed the content that you saw, it would mean the world to me if you forwarded it along to your colleagues at your health plan or at other health plans and spread the word. Thank you.